care of sick patients in the ER. I never planned to go into academics or do research, but I found in community emergency departments I was often bored. I was taking care of people with trivial illnesses, some of whom didn't need any physician's attention at all, much less an emergency physician. And that was not the kind of medicine I intended to practice or enjoyed practicing. So I eventually started looking for a job where I could take care of critically injured and ill patients, which pretty much means you have to go to a trauma center. And that's how I got into academics. I moved to Nashville shortly before the emergency medicine residency was started, and loved the work there. Found out I enjoyed teaching, although I was never a great researcher. I loved teaching and loved taking care of sick people again. I think the biggest thing I tried to do was bring a different perspective to the residents than they were getting from any other attendings. And my approach to patient care was different. After the initial diagnosis, stabilization, and treatment, the residents would usually respond with, all right, well, now let's consult somebody else, when I would ask them, okay, what do we do next? And at that point, I would tell them, well, let's pretend we can't consult anyone, that there's no other service in the hospital. What are you going to do now? And they weren't hearing that from any other attending, so I think I brought something to their education they didn't get anywhere else. After several years at Vanderbilt, because I loved the work there, but it was a grueling job. It was like having 1.5 or 2 full-time jobs at the time. We were working 15 or 16 clinical shifts a month and expected to teach and publish on top of that. And I think that's an unusually big burden for an academic job. And since I've left, they've scaled back. Now the attendings there can either follow an academic track where they do a lot of research, or a more clinical track where they do clinical shifts and they're not expected to publish so much. But at the time, everybody was expected to do everything. And eventually I got worn out by that. And as much as I love the work, once I got over 40, I was less of an adrenaline junkie, and I just wanted a nicer, more leisurely lifestyle. So there was a Democratic independent group in the area which contained some friends of mine, some of whom were former Vanderbilt faculty, and about once a year they would call me and ask me if I was ready to leave academics and join them, and I always said no, year after year. And then one year they called me while I was at work in the ER at Vanderbilt, and they said, well, are you ready to come join us yet? And it just suddenly struck me, and I said, you know, I think I am. So I moved to an independent Democratic group where I was a partner, and there I did take on some administrative and business responsibilities because everybody in the group was an owner and we ran the practice. If there was a plan, it certainly wasn't followed. And that's what I try to tell students and residents, that there is no dream job in emergency medicine because your dreams change. So your dream job right now may not be your dream job in a decade after you have kids. So what you want out of the practice of emergency medicine will evolve over time, and the type of job you want will change with that. Well, there is one other thing, and I can't tell you how important this is. It's live beneath your means and save money aggressively, because it's having a cash cushion that allows you to be flexible. And especially if you're in a non-academic job, I can guarantee you that at some point you will either get fired, or if you're in an independent Democratic group, your group will be wiped out by some big contract management corporation. Outside of academia, emergency medicine is an unstable world. So you need to have at least 6 and preferably 9 months of living expenses saved up in a fairly liquid form. That's the only other piece of advice I would give them, because once you've got that, you can kind of roll with the punches, you can be flexible, You can take time off when you need to. There's never any reason to panic when things suddenly change against your will. I just say that I've enjoyed almost every part of my practice. I loved being in academia and teaching because being around residents and medical students keeps everything fresh. So even if you're seeing a patient with chronic back pain or just a cold, there's some third-year medical student that will find that fascinating, and that kind of enthusiasm rubs off. But I love being part of an independent democratic group and running the business and seeing where the money came from and where it went. And now that I'm semi-retired and working half-time, I really love the freedom of doing locum tenens work and not being emotionally invested in the practice. Now, if I go to an ER and there's a problem there or something that makes working there unpleasant, I don't stress about it. I don't fight to change it. I just tell the company I work for I don't want to go back there. And that's really liberating to have that kind of freedom.